Yeah, you too.
I'm excited for your surgery.
Oh man, I wish I was doing it today.
I know, right?
Yeah.
So we had a chance to review what your concerns were, but just to kind of talk about it again. When you looked in the mirror, when we looked at your photos, we noticed a bit of fullness right here and here, a loss of the jawline in this area here, loss of the neckline in that area there, and then a little bit of descent of the cheek tissues in this area here. So one of the things we chatted about was doing a lower facelift neck lift to address those areas of concern. And I'll just share with you kind of what we do in that surgery. So the first part of that surgery involves an incision placed underneath the chin here. It hides beautifully. The reason for that incision is we go underneath the skin in this area here. If you had any fat for me to liposuction, I would do it at that time. You don't have any fat for me to liposuction, but what you do have is some laxity of the muscle here and the muscle here. It's called the platysma muscle, which creates these bands that we see. In many patients, when I look underneath the muscle band here and here, I see a little bit of hereditary fat that contributes to the fullness underneath the chin. It's oftentimes overlooked, but with the deep plane lower facelift neck lift, we'll directly look at that fat pad, and if it's prominent, we'll reduce its volume and stitch the muscle together in this area here to minimize the appearance of those bands. Basically get those bands removed for you by stitching them together. Then what we'll do is we'll make incisions that are very similar to the ones you had previously. We'll hide those incisions like you had before in the crease here. Whoever did the surgery for you in the past did a decent job with it. We'll hide the incision there. We'll hide the incision here. This earlobe here is a little pulled down, and it's related to little tension at the time of that previous surgery with that previous surgeon. But what I'll do for you is after I'm done with the surgery, I'm gonna tuck up the earlobe for you so it's less drawn down like that. But we'll make the incision behind the ear too so that I can then go underneath the skin until I get to about here. When I get to here, that's where we transition to what we call the deep plane facelift. Do you remember that muscle I described over here? Well, that muscle is not just a band of muscle, it's a sheet of muscle that comes back here and up here. We take advantage of that deeper fibrous layer and we go under it, under the muscle, under it. That's the deep plane. Why? Because the deep plane allows us to do more work here. More traditional facelifts just work back here, but what we want to do is work here to reposition the cheek tissues in a vertical or upward direction. So some people call it a vertical facelift here, or a vertical deep plane facelift, because we're repositioning the tissues in an upward direction in the face here, and in the neck in a back and up direction here. And now you see why we make the incisions the way we do, because we have this redundant skin that we're going to trim. We'll use that redundant skin to our advantage to help tuck up your earlobe here to give it a more natural curve. And we'll reposition the cheek tissues here and trim this extra skin for you through the incisions that we made there. And that's the deep plane lower facelift.